Hi, it's Dr. Lowenstein here. I want to talk about Botox today. And I think that Botox is one of the most asked about things that we hear. And actually, unfortunately, it's also one of the least understood modalities to deal with migraines. So to start with, remember that Botox is a paralytic. So that means that Botox causes muscles to stop moving. So when we're using it for aesthetic purposes, we use it in this area or here, we're trying to stop the muscles from moving like that and causing the overlying skin to wrinkle. When we're using it for the purposes of migraines, what we're trying to do is relax muscle tissue around peripheral nerves so those muscles are not squeezing on the nerve, causing irritation and therefore causing migraines. So when you go to a neurologist, they're going to give you the standard injections, 33 injections, a couple hundred units, and it's kind of like a gunshot. Actually, that's not right. It's not like a gunshot. It's kind of like a shotgun type of approach where they are just trying to vaguely paralyze some muscle tissue that is around various parts, various nerves that we know are addressed. So when a surgeon such as myself gives you Botox, we're going to give Botox usually in a very specific fashion right around where we know the nerve goes. So, we know that there's a nerve here and a nerve here, and we've seen the muscle, so we know where to give Botox around there to relax that muscle. And so when a surgeon gives you these kinds of injections, it's not going to be the same type of thing as when a neurologist gives you Botox injections. So, but here's the important thing for either surgeons or neurologists. The point of Botox is to relax the muscle, and so if there's a nerve traveling through tight muscle, that muscle gets relaxed, and then the nerve is less irritated and headaches are lessened or go away when it works. But there are several other things that can cause irritation of the nerves. The nerve can be crossed by a blood vessel. It can be compressed by fascia, which is connective tissue. And up here, it can actually go through a bony tunnel that's too tight. And therefore, those blood vessels, fascia, or bone are causing constriction of the nerve, irritation of the nerve, and therefore causing headaches. So we give diagnostic nerve blocks with lidocaine to shut down the nerve to see if we can make headaches better, right? You come into my office, you've got a headache, I give you some lidocaine at the nerve that I suspect being the problem. I come back 5 minutes later, your pain is gone. Well, that's an indication that that nerve is what causes the migraine. But it doesn't tell us what is causing the irritation of that nerve. Could be muscle, bone, fascia, blood vessels. If we give Botox to that area and it gets better, then we know it was muscle. So that's why we tried Botox in some cases. However, if we give Botox and it doesn't work, that doesn't mean anything except that Botox isn't working for you. If the constriction and irritation is from either fascia, bone, or blood vessels, Botox isn't going to do anything. But you're still a great surgery candidate because in surgery we can take down the fascia, open up the bony area, remove the blood vessels, do the things that are required to stop the compression of that nerve and therefore the irritation of that nerve and therefore the migraine. So, I just see so many posts online saying, Botox, I'm going for Botox, what do you think? And then so many people say it doesn't work or it worked great for me. Everybody's going to be different. It's not the Botox that's the difference. It's the patients that are the difference. Everybody has different anatomy. Some people have nerve compression from muscle, and in those people, if the Botox is given correctly, then you should find some relief. But many people have blood vessels, fascia, or bone that's causing the irritation. And in those patients, Botox is not going to work. Sometimes I've seen people who have had Botox from neurologists, and because it's kind of given in that kind of shotgun approach of giving a bunch of Botox non-specifically everywhere, that may not work. But then they go to a surgeon who understands exactly the course of the nerve, etc., knows where the nerve is, knows which muscles to paralyze at various different levels, and Botox does work. Same thing with actually diagnostic injections. And again, if you're having, I go through a lot of stuff about diagnostic versus therapeutic injections on our website or on the YouTube channel, so you can find stuff there. But even diagnostic nerve blocks with lidocaine or local anesthesia, I have seen many patients who have told me that they've gotten those kind of nerve blocks from other patients, from other physicians as well, and it didn't do anything, and I give them a nerve block and their pain goes away. So just don't, Botox is a great thing to try. Here's the things to take away. Botox is a great thing to try, number one. Number two, if Botox doesn't work, don't give up hope, okay? And number three, if you are being screened for surgery and Botox doesn't work, but a diagnostic nerve block using local anesthesia does work, you are still very likely a candidate for surgery. And most kind of nerve-oriented surgeons, I was trained by a nerve surgeon. My friends are nerve surgeons, and a lot of those people have abandoned using Botox for the purposes of diagnosis, because a lot of people won't react to Botox, but they will react to local anesthesia, and that means they're a good candidate, and they shouldn't be given up upon just because Botox doesn't work. So I hope that helps clear some things up. It may just muddy the waters even further, but if you have questions, put them down there in the comment section, and I'll do my best to answer them. Okay? Thanks very much. Hope you have a pain-free, it's just before Thanksgiving right now, so I hope you have a pain-free holiday. All right, take care.